Hi everyone, welcome to Kavach Pediatric Q Time. My name is Sindhu and I'm an HR professional and also a mom for two beautiful daughters. And incidentally, Dr. Madhavi has been our pediatrician for over 10 years now. And today I have the privilege to ask a few questions on your behalf. And so with that, let's get started. So Dr. Madhavi, hello.
Hello.
How are you doing today?
Doing well. How about you?
Doing well too. Thank you. Thanks for your time today. For those of us who are meeting you for the first time, would you like to introduce yourself?
I'm a pediatrician and newborn specialist based in Hyderabad. I work with the Cloud9 Hospitals, Hyderabad.
Great. Thank you, Doctor. Doctor, we have some great questions. So let me start with the first one. Very interesting one indeed. From Vedika Ankush Garg. Thanks, Vedika, for sharing your question. How important is milk and what age should we stop milk?
So we all know that milk is the main source of nutrition for babies until 6 months of age. And after 6 months, until 1 year of age, milk still continues to be the main source of nutrition. However, we add weaning foods, semi-solid foods in the form of fruits, vegetables, and cereal porridges. But these don't contribute to the main source of nutrition. Gradually, they take over. That's the intention also. And after 1 year of age, until 2 years, milk still gives some nutrition to the baby for protein, calcium, and other nutrients. It also gives them a lot of satisfaction. After 2 years, solids can completely replace milk. But still, if children enjoy milk, they can take milk. But milk is important only in the first 1 year. Yeah.
Thank you, Doctor. But that's an interesting point that you make. After you're weaned off, most often, post breast milk, they do transition to cow's milk.
Yes.
But because children enjoy drinking milk and it's easier to consume, is there, times when they prefer milk over solids? So how do you actually encourage parents to kind of move towards solids and reduce milk? Is that even a conversation that you have with parents?
Yes, very often. So after 6 months of age, when we start solids, so we encourage parents to gradually increase solids and then decrease milk feeds. Let's say if a child has been taking about 7-8 milk feeds a day, like mostly breastfeeds, and some babies may require formula feeds. We tell parents to first decrease the formula feeds and go with semi-solid foods and then breast milk, and then gradually increase the solid meals and bring down the milk feeds by 1 year of age to 3 or 4 per day. That's the plan, so that we don't bring down their favorite meal suddenly, but at the same time we encourage them to eat variety of solid foods and gradually make the body adapt to nutrition through solid meals. That's the whole intention.
That's so helpful, Doctor. Thank you so much for that. Our next question is from Tata Divya, and her question is about her daughter who is turned 2. She doesn't like milk. How can I include calcium in her diet every day is what she has.
This is a very common scenario, and there can be other 3 scenarios which can be discussed at the same time, having the same answer. So one scenario is child doesn't like milk, simple. Okay, the child has decided I am not going to drink milk. Then you can't force the child. It's not fair also. Then parents try to add sugar, jaggery or some other supplements like Bonvita and try to include milk in the diet. That's one story. Then there can be children who are not tolerant to milk. They like milk but they are not tolerant to milk. So lactose intolerance. And that is another scenario. The third scenario is children like milk but they like breast milk. And then mothers want to stop breastfeeding for whatever reasons. And then but the children are not getting used to this other milk. So many mothers are not able to stop breastfeed because they think that there has to be some milk into the baby, and they are not able to make that shift. So I tell them that it is okay that you stop breast milk and baby is not taking other form of milk, and for those few months or weeks we can supplement the milk, whatever nutrients the milk has been giving, with other solid meals also. So all this is after 1 year of age I'm talking, because we strongly recommend that babies are breastfeed for at least 1 year of age, and even better until 2 years of age. But due to several reasons, a mother may not be able to continue breastfeeding till 2 years of age, and if she wishes to stop breastfeeding before that, then this also can be an option. So these are the scenarios. So now her question, we diverted from her question.
Yeah. So her daughter's
calcium. Yeah, so that is one thing. So because milk is the main source of calcium until 1 year of age, and a good source of protein also, but there are many foods which can substitute the protein, but milk is an easy source of calcium. Okay. So then if we are not giving milk, then what is the what are the other sources of protein? So there are many other sources of protein, and you don't have to force your baby to drink milk every day. So one, you can give curd, and then there is this tofu, tempeh, soya, which are good sources of protein. And then you have these nuts and seeds, but you need to actually give them in ground form or in butter form. And then you have these beautiful moringa leaves. They are excellent sources of calcium, and we haven't really tapped into the benefits of moringa leaves. So these moringa leaves, people don't know how to cook. That's what I thought when I heard from many patients why they are not using moringa leaves. So moringa leaves can be cooked with dal, and you can make chutney powder out of it the way you make with curry leaf powder. In fact, you don't get to make out the difference. And then you can make curry also with it, with little dal, but you need to use little dal whenever you're cooking moringa leaves to remove that little bitter tangy taste in the leaves. And if you saute them in ghee, then that's even better. Then there are these other sources of green leafy vegetables which are excellent sources of calcium, like the methi leaves, the amaranth, and palak. But one thing with palak is palak has a lot of oxalates. So when you are giving palak, you should be careful what you're adding with palak. For example, we all love this palak paneer, but that is a horrible food to eat if you are thinking you have to eat it for calcium. So there is very good iron in palak, and then very good calcium in palak, and then excellent protein and calcium in paneer. But what happens is the oxalates in the palak, they mix with calcium in the paneer and cause calcium oxalate, which never gets absorbed into the body. That is one thing. And then you have this till. Till is that nuvulu.
Yeah, the sesame seeds.
Sesame seeds, yeah. So these are excellent sources of calcium and very, very good source of protein, because they have essential amino acids in that. And the way you eat till, we all know, we can make till sweets, and then we can make till chutney powder. I'm talking so much about chutney powder because my children eat a lot of idli, dosa, and then I show in all these things into the chutney powder, so that ghee, karam, idli will have these powders, and they will just love it. And then this till, you have to roast it a bit. Anyway, that's how we cook, but roasting helps enhancement of the absorption of calcium. So yeah. And when you're doing till sweets, make sure you don't overcook the jaggery. Like, you don't make the jaggery go into that stringy pattern, because children like to eat soft sweets. So you just have to heat the jaggery and then add the roasted till. That's how you make the sweets with till. And there is this Iranian till sweet, which is very good. which you just roast it and then you can add honey with it, but that you give after 1 year of age. That's also very tasty sweet which children like, and we don't have that form here in but one of my friend used to give it to us. I forgot the name. I think it's from Iran.
Okay.
That's a great sweet to eat where you give lot of calcium to children. So as much as we all know, so now you go to ChatGPT and ask what are all the sources of calcium which you can give for a toddler, it will give a big list. But then we also have to know how to give it in a form which the body can assimilate.
Yeah.
Like millets are excellent sources of calcium. And if you're giving some moringa khichdi with millet, and you might be thinking that, wow, we've given a lot of calcium to the kid today. But millets have a lot of phytates. Even these whole cereals, even rice has phytates. So you need to soak these whole cereals, especially millets, for some time, at least 6 to 10 hours ideally, and just throw that water to remove the phytates and then cook. Otherwise, these phytates again will prevent absorption of calcium. By the way, I just forgot to mention my first in the list is ragi, sprouted and malted ragi. In fact, all my babies, where we start with weaning, I tell them to start with ragi as the cereal. You need to sprout, malt, and that's how you need to give ragi. And from 6 months of age, we recommend ragi because that's the time from when the calcium and iron requirements in the baby increase. So ragi is, and with ragi, young children you can give porridge, but after 1 year if you give porridge, they will not eat. Then you can make ragi dosa, ragi idli, and then you can make lot of sweets with ragi. But remember, ragi has to be sprouted and malted, and when you sprout, you soak it for few hours, and that removes the phytates. And I think I've completed the list.
Great, Doctor. I think that one question helped us open up so many other areas. I really love the palak and the paneer combination that you talked about. And I'm sure Divya's question was truly educational in that sense. Thank you, Divya, for asking such an amazing question. Thank you, Doctor. And eye-opening for me too, especially the moringa chutney powder was
amazing. It's very tasty.
Definitely, Doctor. Thank you. Our next question is from Prashanti Goturi. And the question is, what is the dietary recommendation for a 6-month-old baby?
Okay. So 6 months is the time when we start solids. Previously, I used to teach parents to introduce with cereals, because in our custom Annaprasan, we introduce with rice, right? And then for several years, I have been teaching parents to start with rice or sprouted and malted ragi porridge. But I feel a better way to introduce, which I've been teaching my patients for the last few years, is to introduce with natural fruits and vegetables. So even like when you go through many internet articles, or there are many supporters of starting vegetables. Yeah, not the fruits, because they think that children will develop a sweet tooth when you start with fruits. But in my experience, that is not correct. Whether you start with fruit or whether you start with vegetable, if a child has to be a savory type, the child will be savory type. If the child has to be a sweet type, the child will be a sweet type. So, but it is better to start with the natural foods like fruits, vegetables. Vegetables always have to be boiled and mashed. And you have to mash it with hand or cup and spoon. Never use the grinder. Because when you use the grinder, you're first of all removing the natural textures and flavors. And so the child, like if you eat a strawberry ice cream, you really enjoy the texture, flavor of the strawberries? No. So it's the same way. The child has to enjoy the natural texture and flavors, because this is the time when taste buds are developing. And you would want that memory to sit in the child's brain of these natural textures and flavors. So that's one thing. And fruits always have to be mashed. and they should not be heated except crunchy fruits like apple and pears because they're crunchy. So you should just chew them so much so that they just become soft. You are not supposed to boil them in water because all the nutrients will seep away into the water. In fact, there are some funny appliances which boil and mash fruits, and parents keep buying those appliances and keep even boiling and mashing banana also, which I feel is very funny. It doesn't help actually. Vegetables have to be boiled and mashed, and fruits have to be mashed with hand or cup and spoon. That is the way. Suppose some babies don't like to take these small lumps which are there. They start gagging. Like in about 20 children, one child can gag very easily. Today itself I saw a child who's still gagging lumps at 1 year of age.
Okay.
And for such children, what you can do is you can take these. We use this tea. Strainer, a good quality one, and you put it, and then with the cup you strain. Then you will not get the lumps. Don't use the grinder. One grinder, I told you the reason that the natural textures and flavors are lost. Second, you can never clean a grinder properly. Have you ever been able to do it? Like you can't boil the grinder also. So you should not do that. That is the second. And you start with one meal a day. And first 2-3 days you give little quantity and then gradually increase, but your intention should be to give the child as much as the baby wants. And some babies take only 1 spoon or they lick and leave it. Some babies like to eat the whole bowl on the first day itself. But both are okay. You have to accept that and don't compare with another child. And start with 1 meal a day, and in the beginning give only one food. Like today if you are giving tomato, don't give tomato and carrot together. But after 2-3 days, when the child you have already tried with tomato, then you can mix it with another new food. So 1 new food a day, and from the beginning make it a habit to give what you have cooked at home. Suppose you have done tomato dal at home. Then after you boil it, keep it aside, and then without adding salt, and then mash it and give. And as the child grows, then you can add even some dhania or whatever, and gradually adapt family pot feeding into the child's cuisine. That's how you have to do. Then after a week or so, when the child is comfortable with 1 meal, make it 2 meals. So some parents ask me, like first meal, when should be the first meal? You can give the first meal when the child is hungry. So I won't say you have to start with breakfast or you have to give it with lunch or dinner. Whenever you feel the child is hungry and is ready to accept new food, that's when you give. And immediately after a solid meal, try not to give milk because that is not how we would want the child to continue eating, right? So, but some children, if they don't show interest and they are very much insistent on taking milk, then you will have to give. We will have to dance to the tunes of the baby. Then also introduce ragi, sprouted and malted ragi, preferably stone crushed. Otherwise, what you grind it at home. And then also introduce rice. And there's something called ugu, which people in South India make, where they give rice and dal. They basically mix rice and dal. So what proportion I prefer, I will tell. I will prefer 1 portion of rice and one third portion of dal. And many parents actually, they try to include 9 types of grains in that, or some navadhanyas. Are we doing some navagraha puja here? No. So try to include only 1 dal. So this time you make with 1 dal, next time you do with another dal. and then soak it for few hours, drain the water completely, then dry it under sun. In this season, you dry it under sunlight, but in summer, dry it under shade, because the powerful sun rays in summer, they can denature some of the important nutrients. So dry it in shade. Then you roast it little. After you roast it, cool it completely. Then you grind it. And even when you are making ragi, how to make sprouted and malted ragi, soak ragi for few hours, then drain the water and tie it in a wet cloth, and then next day morning the sprouts have to come after 24 hours. If in 24 hours sprouts don't come, discard that, because it will attract fungus. Then you dry it under the sunlight and then roast it and cool it completely, grind it, and then sieve it if you want to do it. So like this, you can include cereals also. And you can give up to 4 meals a day. And if mother is working and she doesn't want to give any other form of milk, and she's not in a position to express milk and send it to the child in between, then you can also give 6 meals. So there are many mothers who leave to work at 9 and come back by 9. So what I recommend is, when the mothers are at home, even through the night, you breastfeed the baby. And during day, whoever is taking care of the baby can give solids.
This was very insightful, doctor. And a couple of things that came to my mind as you were speaking is, each child is different. Keep the food natural. And I really love the way you said that it needs to be a gradual process. I think all three, I'm sure the viewers have heard, and I'm sure they're going to apply that for their little ones. We have the last question for today, and this is another follower on Instagram asking, what is the importance of sugars and its ill effects in toddlers?
So basically, whatever we eat is sugar, right? So because our body, whatever we eat lands up as glucose, and all our organs need glucose. Then why are we telling don't eat sugar, don't eat jaggery, and the glycemic index of all that? Now with toddlers, why should we talk about glycemic index? So this is the relevance. See, when we are getting sugar or the glucose from whole cereals like rice, wheat, millets, so how does the sugar get into the blood? It's a gradual process. The sugars just don't spike. They gradually increase. They just sustain at a particular level, and then the insulin gets released, and then the levels go down, right? But what happens when you eat foods with the real sugar we have in the market, sugar or jaggery or even dates syrup or whatever? What happens is, especially with sugar, in the mouth itself, it will get absorbed into the blood. That's why if there is a patient with hypoglycemia, we tell them to mix sugar or put sugar into the mouth. It will just get absorbed from the blood vessels below your tongue. That fast is the absorption. It will not even reach intestine. In the gut only it will get absorbed. So what happens when there is a sudden sugar spike? It's not a gradual. That will start affecting your nervous system. And in fact, that is one of the theories for Alzheimer's disease also. That is one thing. Second thing is, all these ups and downs and sugars which affect the nervous system of the babies, they can start behaving in a hyperactive way, or that is what we see, but the damage might be much beyond that. Also, this is one reason why insulin resistance occurs also. So, so basically giving sugar directly giving sugar directly in the sense, like let's say you are making a sweet with sugar, that other ingredients in that sweet will go till intestine, but sugar will be taken up from the stomach itself into the blood. that is the reason why we tell don't add sugar to children, especially their nervous system is developing so much in the first 2 years of life. Don't add sugar. So, but children like to eat sweets.
Yeah.
If you see, actually, mother's milk is the sweetest milk. That's why they don't like to drink any other milk other than mother's milk. It's the sweetest milk. So, God has made children to eat something sweet, madhur. So, we have to figure out a way where we give children sweets in a balanced way. That's why we recommend dessert to be eaten after meals, because it doesn't cause sudden spike in sugar. And then so jaggery and sugar are the same, so you can also try with dates and then anjeer, but we don't recommend all these other new forms of sugar like stevia or monk fruit or such things. We don't know how helpful they are for kids.
Okay.
Yeah.
Thank you, doctor. And is it true that children who often crave for sugar, there is, it's usually towards evenings, and they say avoid, if you can, giving sugary, either dessert or drinks after 6 o'clock. So is there anything like that where it's recommended that you give early in the day rather than late in the evening?
So that they burn and use it.
Okay, okay. Great. This was really insightful, doctor. I had a great time asking this question on behalf of our viewers. Some great questions came our way that allowed us to have such a wonderful interaction on this subject, and a lot more than what we asked for. So thank you so much, doctor. And this is all at Kavach Pediatric Q Time for today. Thank you.